Today's dental procedures, such as impression taking or cementation, often require tissue retraction for optimal results. The most common methods for gingival retraction are rotary curettage, electrosurge, and the most popular, packing retraction cord. Although packing cord is effective, it is time-consuming, uncomfortable for the patient, and can rupture the epithelial attachment, causing recession and/or bone resorption. The Kerr Corporation, in partnership with the highly innovative company Pierre Rolland, introduces Expasyl, a quick, painless, and safe alternative for gingival retraction that ensures separation of the marginal gingiva and drying of the sulcus. Expasyl is a very viscous paste that is slowly injected into the sulcus, left in place for approximately 1 to 2 minutes, then thoroughly rinsed with an air-water spray. It not only retracts the sulcus, but controls bleeding and crevicular seepage due to the presence of aluminum chloride. Expasyl holds its rigidity while in the sulcus, creating space between the tooth and the tissue, like a retraction cord. However, because no pressure is needed to apply Expasyl, there is no chance of rupturing the epithelial attachments. Let's take a look at applying Expasyl in an actual clinical environment. The application procedure will be demonstrated by Dr. Ed McLaren, Director of the UCLA Center of Aesthetic Dentistry and Director of the UCLA School of Aesthetic Dental Design. Dr. McLaren earned his DDS from the University of the Pacific, where he graduated Omicron Kappa Upsilon, and later received his specialty certificate in prosthodontics from UCLA. He maintains a private prosthodontic practice in which he does all his own ceramics and is an internationally recognized speaker on dental ceramics and aesthetics. And now, Dr. McLaren.
Today we're here to take final impressions on teeth 6 through 11 of our patient. I will now demonstrate the proper procedure for applying Expasyl in 3 steps. When applying Expasyl, it's important that the area is completely dry. Because the material is water-soluble, if moisture is present, it will not allow Expasyl to hold its rigidity and work properly. Begin interproximally. Lay the syringe against the long axis of the tooth so that you can place its tip on the margin. Lightly lift up the tissue, just as you would with a cord packing instrument, and then express the Expasyl between the tooth and the gingiva into the sulcus. The tip bends easily to accommodate the appropriate angle. Express the material slowly, about 1 to 2 millimeters per second, again into the sulcus, watching to see the mechanical displacement of the tissue, just as you would with conventional cord technique. Unlike packing cord, only minimal pressure is applied, so it's more comfortable for the patient and there is little or no threat of recession. When I am doing multiple teeth, I always start interproximally where I left off with the previous tooth. Keep these 2 items in mind during the procedure. First, if the paste rolls up, you're probably injecting Expasyl too quickly. Secondly, if the paste isn't sticking, you're either not getting it into the sulcus or moisture is present. If you see either of these 2 situations as you go along, just go back and reapply the paste. Another important advantage of Expasyl is that it contains aluminum chloride, which is a hemostatic agent to control bleeding and crevicular seepage. This means you get retraction and hemostasis at the same time. With no bleeding or seepage, you're left with the dry sulcus ready for impression taking. You'll note blanching of the tissue, just as you would see with cord, and of course, that's exactly what you want to see. Remember, like packing cord, it's critical that the material gets into the sulcus in order to displace the tissue. The tissue will not be retracted by simply laying it on the sulcus. Like any new technique, you'll find a learning curve with Expasyl. It may take a little practice, but the results are well worth it. When you're first learning, I recommend doing the procedure on a single tooth. After injecting the paste, leave the material in place for approximately 1 to 2 minutes, depending on the health of the tissue. Healthy, tight tissue takes longer to retract and may therefore require the full 2 minutes. The next step is rinsing. Expasyl rinses easily with the simultaneous air-water spray. To get a clean impression, it's important to remove all the material, so look for any leftover paste and use copious amounts of air and water. The color of Expasyl makes it easy to detect. The tissue looks very good. All the material has been rinsed away. We can see the margins are well exposed, so we're ready to take the impression. However, if you were to find an area with less than ideal retraction, you may not have used enough paste. Reapply the paste to get the desired result. The next step is taking the impression. I prefer a polyvinyl siloxane material and will be using Take One by Kerr. I like the fast set material, but Kerr also makes a regular set. After thoroughly drying the tissue, and while my assistant loads the material into the impression tray, I will begin with the wash. Just like when applying Expasyl, it's best to begin interproximally and go all the way around each tooth, being careful not to lift the tip so you don't trap air. Notice that Take One flows nicely without dripping. My steadfast rule of tray seating is this: whoever seats the tray holds it in place. No handoff. Otherwise, you're likely to get distortion. And here's the impression. A clean and easily readable impression like this, with well-defined margins, is the foundation of a high-quality restoration.
The Kerr Corporation is pleased to introduce Expasyl, a quick, painless, and safe alternative for gingival retraction. For more information, call your local authorized Kerr dealer. Contact your Kerr sales representative at 800-KERR-123 or visit our website at www.kerrdental.com.